The chair now recognizes the gentleman from California.
Mr. Speaker, I'm honored to be here today to introduce my amendment to H.R. 987, the Strengthening Healthcare and Lowering Prescription Drug Costs Act. My amendment would ensure that communities with high unemployment numbers are prioritized in the Navigator Outreach Program. The Affordable Care Act created Navigator programs to provide outreach, education, and enrollment assistance to consumers shopping for healthcare coverage. Robust marketing and outreach programs through the Navigator program have been very successful throughout the country and have demonstrated meaningful benefits to our consumers. In my home state of California, we have been making these necessary investments to ensure people throughout our state get the information they need to obtain coverage, and it works. Our state-based marketplace, Covered California, estimates that its investment in marketing and outreach in 2015 and 2016 increased enrollment, which reduced premiums by up to 8% for all of our enrolled members. That is some savings to all enrolled members by some $576 million, based on a small budget of some $56 million budgets. That is a great investment. That is a 1,000% return on investment. That is a great deal by anyone's measure. And that is the goal, to reduce the number of uninsured Americans. We all know that when we have insurance, we stay healthy. And this strengthens our overall healthcare system, our communities, and our nation. And that's why the Navigator program is so important. And the Trump administration's 84% cut to the program since 2016 is just unacceptable. It's imperative that funding is restored to Navigator programs. Navigator programs help those without employer-sponsored insurance, those small companies, sole proprietors, contractors, and every one of those entrepreneurs who are staking their claim to the American dream. The fact is, many people who are eligible for financial assistance through the ACA, which would help them obtain coverage, don't even know they can get help. And this administration wants to keep them in the dark. Some 40% of consumers today don't even know there's those options available. My congressional district has an unemployment rate of almost 17%. And this is made up of rural communities that face unique challenges and barriers with respect to education, communication, and transportation. This makes it very difficult for my constituents to receive information on their health care insurance options. And this is so similar to many of our rural communities across our nation. For many of those communities, the Navigator program is the only way they can access this vital information. Everyone should have health insurance and know their health care options. Health care is a right, not a privilege, and your zip code should not dictate your ability to obtain health insurance. My amendment would help distressed communities like those in my district and so many more across the nation that may not have the resources to access the full health care options. By fully funding the Navigator program and by focusing our efforts on areas that have high unemployment, we can get more people covered. And that's the goal. Here in America, the building blocks for success are quality education, dedication to hard work, and good health. A healthy workforce is vital for America's success. We must fund the Navigator program to help educate those who are difficult to reach geographically or who have limited access to ACA resources. This is a critical and necessary investment that will build stronger, healthier, and more productive communities in an America that demonstrates that its best investment are its people. With that, I urge my colleagues to support my amendment, and I reserve the balance of my time.